that, and I palpated bad enough. Just palpate again really quick. Okay. Alright, and there we go, we have a sterile sample. Alright, so we have our urine sample here. Just looking at it, you know, it's just kind of mildly yellow, so it doesn't look like it's too dilute, doesn't look like it's too concentrated. I don't really see any red tinge to it or anything, so it looks like, you know, there's not any blood in it. It doesn't really look cloudy, looks pretty clear. So overall, it looks good so far. We're going to go ahead and get a specific gravity on it. Making sure not to touch anything because this is a sterile sample, so close that. Looks like it's about 12, so 10, 12. Alright, and then I'll clean that off here in a second. I'm going to go ahead and put some of this onto a slide. We have a UA analyzer here, so I'm just going to put it onto the slide strip, and then we'll put it into the machine to read. So I'm just going to go through and put one drop, each one. Not touching anything because I don't want to compromise the sterile sample. Alright, I'm just going to shake off a little bit of that excess, and then I'm just going to put it into my machine, hit go, and that's going to go ahead and read that. Alright, so we're going to go ahead and go over things that you can see in a urine sediment. One thing that you see commonly with bacterial infections, you'll see rods or cocci, blood cells. You know, a lot of times you can see like epithelial cells or different kinds of white blood cells and such like that. And that's usually pretty common. Occasionally we'll see crystals. Probably most commonly we see struvite crystals, triple phosphate, stuff like that. Actually, let's see. And I have a little example here. So this is the most common type of crystal that we see are the struvite crystals. Most of these I haven't seen. I think I've seen calcium oxalate once, but for the most part it's usually struvite. You have some uricystine, tyrosine, what are the ones? Ammonium urate, those are commonly found in Dalmatians. Not something that you see very often, but those are probably some of the most painful crystals that there are. Calcium carbonate, that's another one that you see occasionally. So there are many types of crystals that you can see in urine. Some of them depend on if it's acidic or alkaline urine. You know, some might be more common in different species or breeds. So that's a little bit about crystals. We'll go over cast a little bit. I don't see cast very often. Those just kind of have significance to do with the renal tools. You know, and kind of signify if there's any kind of disease. Hyaline casts are just kind of, you know, forms of protein in the urine that are transferred kind of from the renal loops. But here are kind of a couple of examples of what a stained slide would look like. And you have some of the non-stained, you know, urine sediments that you would be looking at to see what kind of a cast looks like. Go over some of the different types of cells. So here you can kind of see some of the red blood cells. Very commonly with bacterial infections or UTI, if it's bad enough, you'll see their bloody urine, so there will be lots and lots of red blood cells. You also have some epithelial cells on here. Let's see, there's some white cells over here on this one. Other one, flip over to where the bacterial slide is. Sorry, we don't have very good. I'm kind of using a book to kind of go through and kind of use that as an example. Here you can kind of see some of the bacteria of rods. I think there's some cocci on there as well. So very commonly in urine samples, you know, an owner brings it in, has bloody urine, usually means that it has a UTI. Commonly, we do see bladder stones. We have seen a kidney stone once. Apparently that's really rare, but bladder stones we've seen fairly often, and I've noticed that they come out kind of in all different shapes and sizes. We've seen quite a few of those in smaller dogs. So that does happen as well. For the most part, I think those are the main things that you'll see on a urine sediment. There is some other different, breakdowns of proteins and other various things on the sites that you can see occasionally as well. And that's about it. Thanks.